Hello, this is Laura White, and I'll be presenting to you our Heart Plus model for service recovery here at Baylor Medical Center of Trophy Club. The objectives for today's presentation are to identify causes of patient complaints and what the most appropriate communication tools are to alleviate those issues, how to identify opportunities to implement the service recovery process, which is our Heart Plus model, and how to be able to effectively use it in difficult situations and feel empowered as an employee to use that process. Every day here at Baylor Medical Center of Trophy Club, we give excellent service. I've seen it. I've heard about it. I know that we are giving excellent care and showing how excellent. But we do know that sometimes in some situations things tend to go. But when that bad situation happens, how do we recover from that? How do we fix the situation and improve the experience for our patients, families, and other customers? We fix those situations by utilizing service recovery. And it's our job, everyone, every day, to help improve the patient's experience, the customer's experience. Sometimes there are large frustrations that can happen, and we wonder why things go wrong. Well, some of the main reasons that things go wrong are frustrations between patients and family and unit challenges. The first ones that we deal with are patient-family frustrations, and the most common one that occurs in the hospital setting, especially in an ambulatory center or a hospital such as ours, wait times and delays are the biggest challenge. These can cause major family frustration, especially because they're here, they haven't eaten, they want to get their surgery done and over with, and now they're frustrated because maybe there was a delay. This can cause problems and make communication a challenge at times. Maybe the physician or the patient changed or canceled the appointment and nobody was notified, or we didn't notify them, and sometimes that can make a problem occur. If we're not talking to our families enough and giving them constant information, they can feel as though they're getting no communication. We may be talking to them, but we may not be talking to them about the situation on a more frequent basis like they prefer. This can sometimes cause stress, anxiety, and fear, along with everything else that causes the stress, anxiety, and fear, such as having surgery, not talking to the surgeon, not knowing where the surgeon might be, not knowing if they're going to go home today, tomorrow, or what's going to happen. So that can cause some issues. If they're on a inpatient unit, sometimes call bells aren't answered on time, and if they are, maybe the family feels or the patient feels that it wasn't answered on time because they may have had poor pain control. These can definitely be issues that can be fixed. The final one is uncertainty. Sometimes patients come in, they don't know what's going to happen. Will they be able to go back to work? Will they be able to go back to doing their favorite activities? Do they have enough money to pay for their bills? These can be big frustrations that cause communication issues and miscommunication issues. When dealing with unit challenges, especially during the fourth quarter, staffing and high patient volume tend to be our biggest issue. It can cause massive challenges, massive frustrations, and cause some miscommunication. Late arrivals by either the physician or the patient will always cause miscommunication. Maybe it was a miscommunication between the physician and the patient or staff. Maybe the physician was in another procedure somewhere else and is on his way here. Maybe they're caught in traffic. Maybe the patient misunderstood what time they needed to be here. This can definitely be a problem, and we want to work on communication. We sometimes have unrealistic expectations and think everything is going to go smoothly and no problems are going to occur. Well, this doesn't happen all the time. So we have to fix our realizations and figure out our expectations. Poor communication can occur amongst team members and other departments. It can be any department in the hospital. It can be dietary and PSU. It can be engineering and PACU. Sometimes we don't communicate well with each other. and we make that a frustration, or somebody may say something that we don't like, and it causes us to be very upset and become emotionally reactive and stressed. So we need to work on these, and that's what we're going to talk about today. The last thing that's a major unit challenge, or can be a unit challenge, is changes in a workflow. We know that changes in workflow happen in healthcare on a regular basis. However, sometimes they come at us too fast and too often, so it can be very difficult to handle those challenges in those situations. I worked at a facility where they had 18 new work processes in a 2-month period. The morale was low, the staff was frustrated, and things didn't get done properly. So it was a major challenge, and we see those challenges that occur in any healthcare setting. So what are some of the common causes of miscommunication that occur between patients and families and between staff members and team members? Well, one of them are communication barriers, both face-to-face, verbal, visual, and non-visual barriers. A lack of listening. Remember, when you're talking with somebody, just hearing them isn't listening to them. Unclear and unrealistic expectations. This can change tremendously amongst people. The lack of teamwork, or the perceived lack of teamwork, and the inability to understand terminology. So how do we improve that communication? We're going to discuss each one of these one by one, because after this it will help you with the service recovery process. These communication issues that we're discussing are common topics and are something you already know, but are good reminders to see how we can fix that communication. When discussing issues with patients who don't speak English as a native language, please use our language line, which is Language Line Solutions. This will help make sure that the translation that is being given to the family and the patient is accurate and correct. I know that this takes time, and we expect that it takes time. And I know that that time that is used can be frustrating when you feel it's going too slow. However, this is going to be the best way to communicate with our patients and families and make sure that they get the information that they need. Try not to use family members as translators because they may not have the medical knowledge to be able to explain that in the most appropriate manner. If a patient is garbled or slurred, please have them try and repeat themselves if you need to. If they're hard of hearing, make sure you speak slightly slower and in a slightly deeper voice. You don't need to raise your voice and speak in a high-pitched tone. That can't be heard as a frequency issue with patients that are hard of hearing. And if you speak slower, it allows that to process in the brain a little bit easier. If a patient is deaf, use the hired hands group that will come in and do their certified sign language interpretations. If the patient has some visual issues, you want to look at your paperwork and make sure that the text is bigger, and you may want to offer to read them the information. We do still have a fairly good number of patients and families here in the state of Texas that do not know how to read. Again, I know this takes some time, but this is going to be the best way to make sure your family gets the information that they need, or your patient. And above all, we want you to recognize that even patients that are dealing with this, as much as you're frustrated with their communication or the communication issues, so are they. Imagine a patient who has had a stroke and is unable to speak because of that stroke. They're very frustrated. I know when I'm speaking and having difficulty speaking that I get frustrated. So understand that when they look frustrated, it may not necessarily be that they're frustrated with you, but they may be frustrated with themselves. The next issue that occurs in many situations is a lack of listening. Again, remember, hearing somebody say something isn't actually listening to them say it. So one thing you have to do is maintain eye contact. And while here in the United States, eye contact is a very big thing, please know that there are some cultures that do find eye contact being an attack. We're not going to deal with that issue today. We'll discuss that at another time when we discuss culture on another presentation. We want to try and avoid any distractions by phone, computer, or any other interruptions. I know this is difficult, especially in healthcare, because many times we're waiting for calls from doctors to get orders, we're waiting for results to come from the lab, we're waiting to talk to the anesthesiologist, we're waiting for calls from family members. So the phone and all of these communication devices can be interruptions. In service recovery issues or when we're communicating, we need to make sure that we put those aside, step away from them, and talk to our person that's having the issue. We encourage using positive nonverbal cues, things like leaning forward, opening your arms, not having them crossed, nodding your head. Even taking notes can be a form of positive nonverbal cue, as long as you ask the patient or family or whoever you're talking to if you can take notes. We want you to listen attentively to that person's concerns and respond with empathy. We've all had the cashier at a fast food restaurant when there's been an issue say, "Yeah, I'm sorry," and not really respond with empathy and not listen attentively. We don't want to do that. We want to be there like we're talking to our family and be there and listen attentively. Don't interrupt the person when they're speaking. It can be very difficult to do that, especially when you want to fix a situation. But we want to make sure that we stop and let them finish before continuing on. Reflect on what the person had to say by both paraphrasing that you understand and summarizing their concerns. Statements such as, "So I understand what you've said is this," or "Let me summarize what you've said in this manner." By doing that, it allows a few things to occur. It allows that person that you're speaking with to know that you either understand it or you don't understand it. And if you don't understand it, it allows them to be able to rephrase what they've stated in a manner that you may understand. It also allows your brain to process the information in a better manner. We state that you ask clarifying questions. We feel that that works very easily. If something's gone wrong and you know that either you don't understand it or somebody said something wrong or somebody said something confusing, many times when you ask that person about that situation or go, "I don't get that," they get a little defensive. But if you state, "I have a clarifying question," that gives them the opportunity to understand that you don't understand and it's not an attack against them, but that you don't understand what they've asked. You can say something like, "I need to ask a clarifying question," or "Help me clarify this," or even "Help me understand this because it's not making sense." By doing that, you can actually help get that information across and allow everybody to understand what the comprehension level is. Many times it can be difficult to know just by looking at someone how they're feeling. Sometimes it's blatantly obvious, but sometimes it's difficult to know. Most times when you hear somebody, you know how their mood is. With visual, it's a little more difficult. So sometimes you need to watch for certain clues. Some of those clues are as follows: jerky, short movements. If they're tight and constricted and jerking around, it can sometimes cause a little bit of a problem. So you want to make sure that you are aware of that. They may square off, cross-armed, stand at you like they're going to attack. They may not, but they may stand as though they are. You want to watch for breathing patterns. Watch those visual cues. Are they having those short, shallow breaths? Are they huffing and puffing and getting very upset? Are they hyperventilating? Those are signs that you want to watch for. They may have a furrowed brow, that pulled down brow. Their jaw may be clenched. You may see ticking in their jaw. Their lips may be pursed. They may even have those clenched fists like they're going to hit something. Sometimes tears are common in both females and males, more so in women. Women get teary at a number of different things. They're happy, they're sad, they're angry, they want to punch something. Women get tears in their eyes. It's just an emotional release. Males will cry, but it tends to happen less often and tends to be more if there's something wrong. So if you see or hear tears, know that there is an issue somewhere. And that crossed arms standing close to the chest, shoulders kind of slumped, or hips drawn back and pulled away. Those are also visual cues that you want to watch for when dealing with patients that have an issue. So you want to do this when you see those clues. Let that person know that you're on their side. Let them know that you are there to help them and you're there to not cause any more problems, and you want to fix whatever the issue is. Keep your face as open and neutral as possible. I know that's very difficult. People can read my face and my mood from a mile away, no matter what I try to do to hide it. It is a practice thing, so practice keeping that face open and neutral no matter what you're being told. Keep your arms down by your side and uncrossed. That crossed-armed positioning is a very closed position and shows that you're not really listening. Again, as with active listening, make sure you're paying attention and you're not interrupting. Ask if you can take notes. And use nonverbal cues again. That nodding, that leaning in closer, that shaking of the head to say you understand or don't understand, that taking of notes. Do understand if they look as though they are going to become violent, please make sure you step away and get some help. We don't want anybody getting hurt, so we want you to stay safe. Unclear or unrealistic expectations are our next barrier. Please make sure you never assume that a customer or a patient, a family member, a doctor remembers everything that they discussed with you in their encounter. Everybody has a lot of things going on in their head and sometimes don't remember everything. So you don't want to assume anything. Confirm that the patient actually understands, or the family member or the doctor understands what you're trying to tell them. And clarify those misunderstandings, whether it be your misunderstanding or their misunderstanding. If it is a gap, make sure you're asking those questions to fill in those gaps. One scenario is I had a patient that I was teaching his diabetic information to. He was newly diagnosed, so I told him he needed to check his blood sugar every 6 hours and then possibly do his blood sugar depending on what his blood sugar was. And he nodded and said, okay, and we went on, and I went back and said, okay, tell me what you remember. The patient stated, well, I remember I have to check my blood sugar 6 times a day, and then I have to make sure I'm giving myself 6 shots of insulin. I stopped the patient and said, no, that seems to be misunderstood. Let me re-clarify it. Let me re-explain it in a different way. You need to check your blood sugar 4 times a day, and if your blood sugar is too high, you can give yourself the sliding scale insulin if it's in the correct parameters. And we went on and discussed a few more things, and then I went back and said, okay, explain to me what you understand. And he said, well, I'll check my sugar 4 times a day, and if it's too high, I'll check and give myself insulin if I need to have it. And I said, yes, that's exactly it. But we had to do that miscommunication, comprehension, and clarification piece. So make sure you're doing that. When you're asking if they have questions, you may not necessarily want to ask, do you have any questions? This is a very closed-ended statement and allows people to automatically say no. They may have questions but are too afraid to ask. So one thing you can say is, tell me what questions I can answer for you. Or what questions do you have? This lets the patient know that they do have questions. They probably have questions and are just too afraid to ask, but it's okay to ask because you're willing and you're opening yourself up for answering those questions. So just know you may get an answer of no, even though they really do have questions, and that can cause some problems in the long run. But just be careful and watch that situation. One of the things that I have seen in my career that is one of the largest barriers is the lack of teamwork. Many times this is because we don't communicate with each other. As generations change, we stop communicating face to face. We get wrapped up in our own little worlds and we don't ask for help or we don't offer help because we're trying to do everything else. But we need to openly communicate to make teamwork flow more smoothly and actually be effective. One way we do that is by actively listening and responding to things in a very constructive manner. Negative feedback, critical feedback doesn't allow us to actively listen or respond in a manner that's conducive to a good team environment. So, actively listen. If you see somebody on the unit who's running around in a tizzy, can't get everything straight, they haven't eaten lunch, it's 4 o'clock in the afternoon, and it's just a mess for them, but they don't ask for help, or you see that person running around not getting help, not asking for help, and you're just watching them, you need to communicate with each other. The person who is running around crazy needs to not feel like a failure and needs to say, hey, I need some help, I'm drowning. So make sure that if you're that individual, you ask for help. Stop, take a deep breath, and ask for help. The flip side of that is, if you're available, ask people if they need help. What can I do for you? What help do you need? Those questions allow us to say, no, I think I've got it, or, hey, I'm really struggling. Could you go grab my patients in these 2 rooms some ice? Or, I've got to get this medicine to this patient, but could you go give this pain med to another? Or, I can't get this light fixed. Can you do it for me? Get help. We can't read minds. So offer help and ask for help when necessary. If there continues to be issues, make sure you keep your manager up to date. They know that these situations occur, but by you talking to them and keeping them up to date, you're not tattling, but you're keeping them in the loop. Many times managers have other duties and aren't able to keep up with everything that's going on the floor on an hour-by-hour basis. So make sure that you're keeping them up to date. Above all, respect everyone you come in contact with. We don't know what's going on in the background, and if somebody comes across as mean or angry, it doesn't necessarily mean that that's you, but maybe there's something going on that they can't talk about. So be respectful of everyone. One situation that you can come across is that the unit is overwhelmed and unable to keep up with things. Now, here at the hospital, your unit can call team support overhead. And what team support is if this happens to your unit and it's overwhelmed and you need help, by calling team support, anyone who is available to come assist will come and assist. And they will help you do whatever you need, whether it be pulling patients up in bed, turning patients, pulling meal trays, getting vital signs, just talking to patients or wheeling them out. Whatever the help is needed, they will come to help you. This is not in place on night shift. This is only a day shift thing because night shift has fewer people on staff and it's easier to contact others. During the day, it can be a little hectic, so calling team support overhead will allow you and your department to get the help you need in a timely manner. Many times, the inability to understand terminology is a major barrier. And the reason this occurs is because people are afraid to ask what that means. Nobody wants to sound stupid or like they don't know what they're talking about. So many times a question about a term won't be asked. To help make this easier, make sure you use non-technical terms and try not to use medical jargon or acronyms. As a healthcare provider or working in a healthcare facility, this can be difficult. We spend most of our time speaking in medical jargon, acronyms, and using technical terms. So this is something we must practice on a daily basis. By doing that, we can communicate with our families and our patients and our customers much easier. Most individuals have a 5th grade level of communication. So many times the written information that is considered patient-friendly is set on a 5th grade level. So we want to make sure we're using those layman terms and talking in an easier, slow manner, not sloth slow, but slower so it's easier to understand. And we want to make sure patients aren't afraid to call back with questions or ask questions. Many times people are too afraid to ask because they don't want to look like they don't know what they're talking about. People don't know what they don't know, so let them ask questions. Let them call back. Encourage this. One story that I have occurred when I was working as a cath lab recovery nurse. The patient had just come back to me. The cath lab nurse was at the bedside helping get them ready to go or to come back, and the patient had been on the table, was a little groggy from the sedation. The cath lab nurse looks at him and says, "Well, we fixed your RCA and your OM, but now you're here and we need to do an ACT so we can pull the sheath and then get you to the ICU." And the patient stopped and looked at me as I was helping get report and everything. And he said, "I don't know what she just said." So I stopped and said, "Well, they've put a balloon and stent in 2 of your arteries to help open up the blockages in your heart so your heart can get some oxygen. We now have you laying flat because you have a tube in your leg, and we're going to have to draw some blood to see if you're clotting and how fast you're clotting before we can take that tube out of your leg. Once that's done, we can send you to the intensive care unit so you can recover and go home." He looked at me and said, "Oh, well, that makes so much more sense." So try and avoid those jargon and acronyms. I know it's difficult. It's a practice thing. Practice on your family, practice on your friends. Work on that and make sure you encourage people to ask questions and practice that terminology. One other part that we look at is scripting, and how does this play a part? Scripting in many cases is just using common phrases or not using certain phrases that we're used to hearing. I know one of the biggest pet peeves of many people is hearing that "that's not my job." While it may not be your job, it is your job to help that patient or family member or customer. So instead of saying "that's not my job," you can say, "Well, let me help," or say something like, "Well, let's find help or someone who can help you," or "let me find someone who can help you better than I can," or "let me direct you to somebody who has better knowledge and let's go there together." That lets the patient or family or customer know that you're willing to help and you're there for them. The phrase "how are we feeling today" is very frustrating, or "what are we up to today?" You are one person. That customer that is engaging with you is one person in general. Don't say "how are we feeling today?" It's "how are you feeling?" It's more personal and allows them to see that you care about them as a person. While not saying the patient's first name, you do in HIPAA situations when you're bringing a patient back or legally verifying their name and date of birth, you need to use their legal name. That is understood. However, to allow that patient to understand, or that family or customer to understand that you want the best for them and that you're caring for them as an individual, ask them, "What do you prefer to be called? What can I call you?" I had a band director in high school. His name was James. He never went by James. He went by Buck. If anybody called James, he didn't even hear them. So ask them what they want to be called, because that is going to help let them know that you care about them personally and aren't just there for a name and a number. The last phrase that is on this that you should not say is "I don't know." If you say "I don't know" and leave it at that, that allows that family or customer to develop an opinion of not only the person, of you, but of the facility. Why would the facility hire somebody who doesn't know? But if you say, "I don't know, but let me find out," or "let's find out together," that lets them know that you're willing to get the information, you're not just dropping the ball, and they're not going to be dropped within the system. So just let them know that you're wanting to help find out, and you'll get them that information that they need. So now that we know what the cause of most of our complaints are, and most of them are communication, what do we do to handle them and make sure they get taken care of in a timely manner? So now that we know what causes customers to complain, how do we fix that? Well, we use service recovery. What is that exactly? Well, service recovery is the opportunity for us to fix any errors that we may have caused to make a patient's or customer's experience less than what they expected. With service recovery, we aim to change that patient's experience or that customer's perception of how we took care of the situation. We want to create what's called a service paradox. A service paradox is when a customer complains and the company that's being complained to goes above and beyond to fix the situation, and that customer becomes a customer for life and a loyal customer and raves about them and shares that with everybody. That is a service paradox. That's what we want. We want to bring those people back into our company's family. So we create that. Remember, all complaints that we received are a gift. We can't fix a situation if we don't know about it. So being told about a situation allows us to fix it, make sure it doesn't happen again, and helps that customer's experience. Here at Baylor Medical Center of Trophy Club, we use the Heart Plus model. The Heart Plus model stands for hear, empathize, apologize, respond, thank, and track. These are 6 easy steps that you can utilize to help fix a patient's perception and change their experience for the positive. The first piece that we want to do is we want to hear. We want to hear that patient's concerns and actively listen to what they are complaining about. We want to use phrases such as, I understand what you're saying, I hear you, and speak slowly and clearly. Don't interrupt and let them finish their statement and find out all of the information. We need to try to remain calm and don't become defensive because it's not a personal affront, but something that they want that doesn't meet their expectations. So realize it's not personal, so don't become defensive. When we are doing our E, we're empathizing. We're putting ourselves into their shoes. This is when the phrase, I understand how you're feeling, comes into play. By stating, I'm sorry that that happened to you, that's sympathy. Empathizing or empathy is when we say, I understand and value what you're saying to me. I understand and want to help you through this. Acknowledge that their feelings are there and treat them like they're your own family member. Treat them with respect and let them know that you're here to help. The A portion is for apologize. This is when the person is looking for a genuine, blameless apology. We don't want to be defensive and we don't want to share any guilt that may have occurred. By doing that, it conveys a sense of caring and wanting to be there for that individual. Make sure that even if you didn't cause that problem, you're saying, I'm sorry. And you want to make sure you're strictly using the phrase, I'm sorry, not we're sorry. I'm sorry is more personal and lets them know that you as an individual are concerned about this situation and not that it's being lost in the stratosphere with a we're sorry. When you apologize, you need to be genuine and sound like you mean it. We've all had that waiter or waitress or cashier who's like, yeah, I'm sorry, we had this problem. Well, that's not a genuine apology. We want to be genuine. We want to be heard. We want them to know that we heard them. So be engaged. One fact that's out there from a customer service research site states that 45% of customers will withdraw any form of negative feedback if they receive an apology. If they only receive compensation, only 23% will remove that negative feedback. Nobody needs a coupon for an extra cheeseburger. That doesn't make the situation any better necessarily. but an apology will. Also, there's some medical research out there from the ISMP, the Institute of Safe Medication Practices, that when a medication error occurs, an apology, a genuine apology, will prevent 80% of those from going to litigation. So that's a very big thing, and we want to make sure we're giving genuine, blameless apologies. To do those blameless apologies, you have to remain guiltless. So, I'm sorry that we didn't meet your expectations. I'm sorry you haven't received the service that you deserve. I'm so sorry that you're hurting or that you had such a long wait. Those are not blameless. They're genuine apologies showing that you know that they are upset, but you apologize for it. The non-blameless apologies are things like, well, I'm sorry, but it's such a zoo around here. I don't know what's going on. Or, I'm sorry we're so short-staffed, but this happens all the time. Those are things you don't want to say. It doesn't convey a caring nature and doesn't show that the hospital has the patient's or the customer's best interest in mind. So make sure you're using blameless, genuinely caring apologies. Sometimes responding is the hardest thing to do because we don't feel that we're empowered to do anything about the complaint. But please know that here at Baylor Medical Center at Trophy Club, you are empowered to fix anything that you can handle right then and there. If it's easily fixable, we want you to fix it. If it's something you can't handle, talk to your manager, talk to your senior leadership, and let them help you. Either way, we want you to do it quickly. So to do this, the first thing you need to ask the person who's complaining is, what can I do to make this better? Or how can I improve the situation and fix your experience and make it better for you? Give them time to think about it and then let them respond. Sometimes it's a very simple, easy fix. I just need some more warm blankets. Or I just need a gown to cover my backside when I walk to the bathroom. Very easy fixes. Sometimes it's, I want my whole hospital stay paid for, so I don't have to pay for it. That's not something you can handle. In those situations, take it above to your manager. If you need to, go to senior leadership. Let them try to handle it. Or you can offer other choices for resolution and give those patients a choice of one of those. Either agree to their solution, present choices for resolution, or get the manager or leadership. That will help. Again, no matter what, you want to do this quickly. The quicker we get this situation fixed, the better the outcome. The longer it sits and wallows in that patient or that customer's head, the worse the perception of it is, and the worse the situation becomes. So respond quickly. The last piece of this is thanking and tracking. Always, always thank the person for letting you know. Thank you so much for bringing this to my attention. I appreciate this, and we will look into it. If you don't know about the situation, you can't fix it. So thank that person. Thank you so much for letting me know. Also on that customer service research site, they have found that for every one person who complains to a company about a problem, there are 26 others who will say nothing to the company, but they'll tell all of their friends on Facebook, Twitter, Instagram, and whatever the most popular social media piece is that day. So thank them for that gift. We appreciate you telling us this. We appreciate you bringing this. I appreciate you bringing this to my attention. Make sure your manager is aware of the situation by reporting it to them. Even if they don't have to be there to fix the situation, they do need to be aware that it occurred. It is reported daily at the huddles if there are any customer service or service recovery issues. So make sure you let your staff know that you need to know if you're a manager. Then finally, once everything is done and thanked and handled, make sure you rate and complete an EDGE or MIDAS report. This way we can track issues and notice trends, and if there's a problem, we can go back and find out where it started and how to fix it. It gives us those process improvement opportunities and allows us to fix the situation. So make sure you're thinking and tracking. So what we're going to do now is we're going to look at two different scenarios and how they can be handled for customer service experience. I want you, while we're looking at these scenarios, to think and to practice using these methods, specifically the Heart Plus method. For scenario one, a patient received their evening meal tray and they ordered it according to their own ordered diet. So as the nurse tech, you check to make sure the patient's sitting up and is ready for their meal. After opening the tray, the patient pushes it away and says, "This food looks disgusting. How on earth can anyone eat this garbage? Well, just forget it. I won't eat tonight, I guess." So how, utilizing the heart method, would you handle this? Take a moment to pause your screen and then think about how you would handle this. And then when you're finished, come back. So the first thing you want to do is hear, empathize, and apologize. And you can do this all together. "I am so sorry that this occurred. I hear how frustrated you are and understand completely why you feel this way. I understand how you're feeling. I am so sorry that the meal isn't set for you the way you like it, or isn't what you like." To respond, you can say, "What else can I get for you to make sure you eat? I don't want you not to eat, as you need to eat to get healthy. So could I get you a sandwich or soup or something else? Let's take a look at your menu for tomorrow and see if I can help you with some choices so you have a better eating experience." Find out, maybe you can respond, well, if they like something from outside, maybe their family can bring it. Or maybe I can get you peanut butter and crackers and just make you a sandwich. Think of responses that can help. And then thank them. "Thank you so much for letting me know about this and sharing how you feel about the dinner tray. I'll let both my manager and the cafe manager know so this doesn't happen again, or so that we can get you the meal that you'll eat so you can get healthy." Any kind of scenario such as that will help. For scenario two, you are the charge nurse and you hear a patient complaining to their nurse, "What's the point of me coming in at 5:30 in the morning for a 7 a.m. surgery just to be here at 8:30 waiting for the doctor? Where is she? This is getting ridiculous. I'm starving, and if they aren't here in 10 minutes, I'm leaving." How would you handle this situation using the heart method? Again, pause the screen, think about what you would do, and then come back. When looking at the Heart Plus model, you want to make sure you hear, empathize, and apologize again. "I'm so sorry that things are running behind. I hear how frustrated you are about this, and I know you're upset. I completely understand about not being able to eat, and I understand how you're feeling. I am so sorry that we're behind." Once you've done that, respond. "Well, for your safety and for your health, we do want you to have your surgery. I'll contact the physician and see if I can find out some more information for you. I also will make sure I check on you more often and let you know what's going on. Is there anything I can do for you right now to make sure you're more comfortable? Can I get you a warm blanket? Can I turn on the TV for you?" Getting in there and making sure you're talking to the patient more often is a good way to help with that response. Find out from the physician where they are, where in the process things are going. Let them know for their safety. That's one of the reasons we get you here so early, to make sure that we have all the labs and everything we need so your surgery goes on time. You also can say the doctor is unavailable right this minute due to something that came up, but he provides quality care and he's providing that quality care to that patient that they're going to provide to you. You can use that if they're still in surgery with another patient or if they ended up getting called to another facility. But come up with good wording that still remains blameless and has a good response. Again, thank and track by saying, thank you for letting me know about this and sharing how you feel about the situation. Again, I understand your frustration. Because of this, I'm going to let both my manager, the OR manager, and the physician know how upset you are about this and see what we can do to fix it. Using those will help the situation and allow you to thank them in a positive manner. Make sure you go back into Midas to track it. So, in conclusion, all members of staff here at the Baylor Medical Center Trophy Club are encouraged to initiate the Heart Plus method when necessary. You have the opportunity to help fix the situation quickly and help them recover and make things much smoother for them. In fact, anybody who sees that concern or hears that concern first, any need, any complaint, you are empowered to fix that and start the heart process. It doesn't matter who it is. If you were the first one to hear it or see it, we want you to address it. This helps restore customer trust and help with any service breakdown and help us fix that and create that service paradox. We want to remember that every day giving excellence is what we do, and treating our customers like they're our own family is how we can fix any situation by using the Heart Plus process. Please contact me for any questions or comments about this presentation. My number is listed, or you can email me. Thank you very much, and I hope you have a great day.